One. Hello, so it's Debbie Johnson here from Pilates in Bridgewater, or DJ Fitness and Pilates, and I'm talking this evening with Debbie Dillon, who is a clinical physiotherapist in pelvic health, a specialist in pelvic health. So Debbie, good evening to you.
Hi Debbie.
It's a busy day, and tell me exactly, what is a specialist in pelvic health? What do they do?
Right, well, I'm a physio, so we deal with muscles. And my specialist is kind of looking after muscles all around the pelvis and particularly the pelvic floor. So that would entail seeing, everyone presumes we see just women, which we do, so who are pregnant, who have had babies, who have any problems with their pelvic floor, such as leakage, prolapse, any sexual dysfunction, any pelvic pain, and a tummy gap. But more importantly as well, or not more importantly, but equally as important, we also treat men and with their pelvic floor problems. So men who've had prostate removed and might have a bit of leakage or urgency, and men with pelvic pain, erectile dysfunction, and actually men who are having other sexual dysfunction, such as hard flaccid syndrome. So they're the things a lot of people don't realize we treat.
Right, okay. And does that also, it's not just incontinence from the front passage, but does that include
yeah, no, you're right. Yeah, sorry, I always forget to add that in. Yeah, we treat bowel issue as well. And so not alone do we treat leakage of bowels, we might treat people who have holding of wind problems, so flatal incontinence, but also we can treat people with constipation problems.
Right, okay.
Yeah, which is very common, especially in the women.
Yeah, that's it.
Yeah.
And I guess you see a lot of women, because women do talk more about these things, but guys are a bit reticent in coming forward, aren't they, really?
Yeah, no, they are. I mean, unfortunately, at the present, this minute today, I'm not commissioned to see the men currently in the NHS. I'm really trying hard to change it, and it will change, hopefully sooner rather than later. But, the evidence out there to show that men having attended and done a prehab of their pelvic floor before having their prostates removed makes such a difference. So that's not alone on the leakage, but that's also on erections and kind of erectile dysfunction issues. And so, equally the other, that's kind of seems to be the known one with the men, prostate issues. But equally, it's also, if they have pelvic pain, sometimes it can be their pelvic floor is just not working well and too tight. So it's, it might be their glutes are weak. So you need, their pelvic floor is overworking. And as I said earlier, so any sexual dysfunction, so, hard flaccid syndrome, or not being able to keep an erection, and all the different functionings. And we also deal with an issue of the penis called, oh my gosh, it's gone right out from my head. Where there's a curvature in the penis.
Oh, I know, yeah.
That is all Peyronie's disease.
Oh, yeah.
And we can treat that as well. But these are still a huge area we're having to educate the medics on, not to mind the public. Yeah. So it's a huge developing area. It's still really slow. I think probably because men don't come forward as much as women.
Yeah.
But
yeah.
In my private practice, I treat a lot of men, and a lot are coming forward in the last couple of years. There's much more men coming forward, which is great, of all ages, not just the older men. I'm getting an awful lot in their 20s and 30s.
As well. So I guess weightlifters, maybe they've
you can get some weightlifters, but very often it's some people who've come with the tight pelvic floor, so maybe from cycling. So all of a sudden, if they've gone on big long rides over a kind of a period, or gone off on a cycling holiday, equally I'm also getting, it can be the pelvis can hold a bit of tension. So, some of those personalities, that might be that's where they're holding their tension and they're not realizing it. And then it's the straw that breaks the camel's back, that they, had a hamstring injury. So all of a sudden their pelvic floor is even working harder.
Yeah.
And a few people with hip problems as well, they might try and compensate using their pelvic floor. So like anything else, if you hurt your knee, you might use your other leg, much more to kind of compensate on because you're limping. It's the same when you get a bit of a dysfunction of muscles. It's the exact same with pelvic floor, but people don't think of it like that. Yeah. So some of the men just come to me and have, no issues with erectile dysfunction or anything, but they might just say, my God, I really need to rush to the bathroom. I can't hold on. But if that muscle is squeezing around that bladder, then it's going to make it feel like as if they're urgent and need to go. So, you know, it can be something as simple as that they come to me with.
Okay, so men as well as women, so we've all got the same sling. What I say to them all is we've got the same slings of muscle, just different numbers of openings, haven't we? But
Yeah,
the same basic structures, really.
yeah, no,
So
exactly.
men, please go and get some help. Don't suffer in silence. Women have known this for the last few years, and they get help. But men, guys, come and see Debbie. And you work privately, and you work for the NHS.
Yeah, yeah. So I can see it's all women in the NHS, and privately I see ladies as well. But unfortunately, as I said, in the NHS, I can't see men currently, but I can see men privately. And my practice is just outside Wells in the Harringtons.
Right. Okay. That's lovely. But with COVID, I guess you're doing a lot of like this Zoom is with us now.
Yeah, it's all
things with
all virtual. So, like, if somebody has a problem, you can either, you know, refer yourself directly into privately, but if not, you can go to your GP and request that you get referred into a physiotherapist. Obviously stipulating that you need a pelvic floor physio.
Okay.
To them sometimes, you know, because they mightn't understand. So most of the GPs are very good, especially with the female problems, they're very good. And so that's all they need to do. And then at the moment, nearly all physios, but in the NHS and privately currently in any pelvic health, what we're doing is you have to do a virtual assessment anyway by our professional bodies. That's the advice. Currently, I'm not doing any clinical on-hands practice anywhere, so there's no pelvic physios working face-to-face at the moment. So we would see you virtually. It's incredible how much I'm actually beginning to be able to treat people virtually. Yes, you do miss the hands-on, but I'm actually been quite surprised because some of my job, depending on what I'm doing with the person, is a lot of education. So there's an awful lot I can do like this. I mean, I had a lady today standing up, you know, showing me how she was tilting her pelvis, and she was pregnant. I was getting, you know, seeing her movement. So there's an awful lot I can do without having to touch somebody. If somebody really requires having, for their pelvic floor, somebody requires having an internal, which is what us physios do to check the pelvic floor muscles, then they will have to wait until we're doing face-to-face again, or until I'm doing face-to-face in my private clinic. So, you know, but there's a lot of advice we can get them started with and get them up and running. So yeah, so that's kind of where we're going at the moment with the virtual. Ideal situation, I would also do a vaginal or a rectal examination on the men if required, to see what's happening with the pelvic floor.
Yeah. But men can come. I mean, the best thing for guys who can be a bit inhibited is that they can just talk to you like this, and nobody needs to know. Not even their partner needs to know. They're talking.
No, exactly, because you plug in like this, nobody knows what's going on.
So guys, it's an ideal opportunity. COVID has brought so many challenges, but it's brought quite a few opportunities as well. And some guys may be a bit concerned that they've got to sort of drop their trousers in front of you, but that's not always the case, is it? Sometimes
no, there's not always the case. A lot is chatting through. Obviously, if I feel from the assessment, and it's like a jigsaw piece, a puzzle, putting everything together. So if I really feel, you know, I need to check everything's working, then I might have to examine them. But, you know, that doesn't always happen on the first assessment anyway. There's so much I need to ask them. And obviously that will never happen, which should never happen with any pelvic physio online that will be doing anything like that, just to reiterate. And that there's no preconceptions, nothing like that, you know, but, you know, we can really educate and teach you how to work those muscles, because yes, it is in the pelvis and in the pelvic floor, but equally your abdominals are all part of working the whole pelvis, as is your diaphragm. So, you know, there's a whole lot more to it than just working your pelvic floor. So we have to make sure the breath. So most patients who come near me, and I'm continuously educating my colleagues on it, is you always start with the breath, and then all the rest will come right. The breath is incredible because you'll get a proper contraction then.
Yeah, yeah. And so people can actually help themselves by contacting you. It's not a case of you fixing people. It's a case of you helping people understand how they get feedback from their body and what they can do about it and how they can improve things. So they can do quite a lot of things to help themselves. And I know you've got some ideas on that.
Yeah, no, there's plenty people can do. So as I said, I'll always start with breathing. So I might be sending them home and getting them to do some breathing exercises. And the same now, you know, practice that you can breathe, you're breathing well to start with, and then starting on your pelvic floor, which would be basically the whole analogy as a squeeze and lift feeling, so that you're pulling in from the back passage as if you've a zip all the way up to the pubic bone. And so that's particularly for the women. So a squeeze and lift, zipping up from the back passage to the pubic bone. But for the men, it's more kind of nuts to guts. So more from the testicles upwards, not as far back as the back passage. And so that's just the slight difference in just anatomy and teaching. So we say nuts to guts for the men, and more squeeze and lift for the women. So the zip from the back passage to the pubic bone. And then there's two ways to do it. Your endurance, which I call the Mo Farahs, and your speed, which is your Usain Bolts. And so the happy number is 10, so that the max you do is 10 seconds hold, rest for 10, and repeat that 10 times if you can, and breathing. And then the quick ones are you squeeze, let go, squeeze, let go for 10. And that's the basic pelvic floor exercise. And then we can progress from there. So once you can get somebody to grasp that, and there's a lot I can teach on just getting that working, once somebody is aware of what's going on down there. If somebody isn't aware, that's difficult. That's kind of the first port to call, as well as bladder advice. So correct, you know, drinking the correct fluids, the right amounts of fluid, and bowel advice is huge as well.
Yeah, because sometimes there's the diet plays a large part. I mean, I've heard that carbonated drinks can cause irritation, can't they? And
yeah, so sometimes you've different types of incontinence. So, you know, you've the stress urinary incontinence that people go, you know, laugh or cough or sneeze and you have a leak. But you also have where, you know, urge incontinence is where you have the detrusor muscle, which is the muscle in the bladder, has receptors. And these receptors literally, you know, kind of just get aggravated. So I'm okay. So it might tell me, Debbie, you need to go for a wee, but I'm all right because I can sit here, not a bother. But for somebody who has issues that these are really annoying them, you know, they'll just need to go straight away. And sometimes if they don't get there, they can get have leakage. So it's about bladder training first. And the best description that I always use, it's like a naughty child. Give it an inch and it takes a mile. And that's so much the bladder.
It's the bladder. And it's the same with fecal incontinence. So that's when you poo yourself or you've got a little bit of leakage. But fibre plays a part in that, doesn't it? And
yeah, it's a huge part. You know, and and most people these days have heard of the Bristol stool scale. So it's making sure you're on the right aspect of that stool scale, not too hard, not too soft. So like Goldilocks, you know, stool. So, and it's really important because for those people who haven't got a great pelvic floor, and if they're too loose, it would be much harder to hold.
Yeah.
And then if you're too constipated, then it's going to make your bladder not work as well if you've got those issues as well, because it's going to be pushing on it. So it's really important for us to look at somebody in the holistic way, as well as if they're really stressed and going through a really traumatic time in their life, then that's going to add in, you know, kind of issues. So we have to look holistically. And at the moment is a perfect example. Women's Hour last week did a little clip on it. I've seen somebody else speak about it on Instagram this week, is with lockdown and lack of toilet use, we have an awful lot of poor people who are actually isolated in their homes because they're petrified of peeing, you know, inappropriately or needing to go kind of out in the wild.
Yeah.
And so big issue because we've got our toilet chasers who know exactly where every loo is to what they're going to do or where they're going to shop. And so that's a big issue as well at the moment. So, you know, there's plenty out there that we can help with people to get them, you know, everything going as best as we can. And if not, getting them to the right places to get the help.
Right. So that is for men and for women. Please listen to this whole thing. This is about all of you. Please don't suffer in silence. And Debbie, if they want to contact you, I know that they would normally refer themselves through the NHS, through their GPs, and that's women. But if guys can't access that, then I'm going to put a link on the bottom with Debbie's details. And
the best way is through the website. So Debbie Dillon, pelvichealth.com, and then there's a link onto they'll just can email me straight away from there. Yeah.
Right. So guys, don't suffer in silence. Thank you very much for joining us tonight then, Debbie, and for giving us the benefit of your knowledge.
Thank you, Debbie. Always lovely to catch up, and thank you for all the great work you do. Keep it going.
Thank you.
Thank you. Bye.